All right, we're continuing on with chapter 9. So you have to use critical thinking when you're assessing a patient. Sometimes they give you a bunch of puzzle pieces and you have to figure out how they fit together. So there's a couple of different things that critical thinking involves when we're talking about assessing a patient. So gathering is literally just pulling in facts to help you make your clinical decision. Evaluating is actually considering the information and what the information actually means for the patient and for the condition that they're presenting with. And then synthesizing is actually taking that information, putting it together in a way that makes sense so that you can actually use it to develop a treatment plan to either manage the patient, the scene, or both at the same time. When we talk to patients, we often have to bring up very sensitive subjects. Keep in mind that we still need to get the information, but the way we go about it, we might need to be a little bit more sensitive. You don't necessarily need to beat around the bush. You can be very straightforward with some of the information that you're trying to gather, but kind of keep in mind how you're asking about it. Alcohol and drugs is very, very frequent. Signs may be confusing, they might be hidden, might be disguised. Your patient might be in massive denial that they have any problems. A lot of times they are. Your information that you're getting from that patient may be completely unreliable. You might be looking at them going, you are so full of it. Don't say that to them. Take what they're saying with a grain of salt. If you know that they're blatantly lying to you, but don't outwardly judge them for it. That's not going to help you. That's going to immediately break trust with your patient if they feel like they're being judged. Try to be professional in your approach. A lot of times, patients that are high or that are drunk or that have come to some sort of injury or illness because of this, it can be frustrating to see the same person over and over and over because they have this chronic alcohol or drug problem and they're not able to get it under control. And you can truly see the detriment it has on their lives and the lives of those around them. And sometimes you just kind of forget that you need to be compassionate. So just be aware of your own personal biases. Physical abuse or violence, you need to report it. First and foremost, you'll be surprised at how many people don't want to report it. You need to. There's local protocols and state laws. South Dakota happens to be a mandatory report, mandatory arrest state. So if somebody calls in domestic abuse, violence, fighting, that sort of thing, it is a mandatory arrest state. Don't accuse. You're not there to determine who's guilty and who's not. That's what the police are for. So call them in, let them sort through all of that. You can go ahead and just take care of the patient. That's your main consideration. You do your job, let the police do their job. Talking about sexual history. The thing that we say is kind of a general rule is that consider anybody of childbearing age who reports abdominal pain to be pregnant. Just assume that. So a patient from 9 to 90 who hasn't, without a doubt, gone through menopause or sterilization could be pregnant until proven otherwise. Questions to ask when faced with this kind of in the pre-hospital realm. So you want to ask when your last menstrual period is. Are your periods normal? They do change. Sometimes they're heavier, sometimes they're lighter. We kind of want to know if their period has changed recently, because that can be indicative of a pregnancy as well. If your patient is currently bleeding, you want to ask them, how many sanitary pads or tampons have you gone through, to kind of give you an idea of how bad they're bleeding. If they're going through a pad an hour or a tampon an hour, that's pretty heavy bleeding. Most patients can go several hours without needing to change. So that gives you an idea. Urinary frequency or burning when you pee, you want to ask males about that as well. Any sort of urinary symptoms, you'll ask to both male and female. Females are much more susceptible to urinary tract infections, so it's likely that they could be experiencing that. Males, though less likely, can still have a UTI. If they're having some sort of cramping, something going on, for women, you would ask, what's the severity of your cramping? Do you have any vaginal discharge? And is there a smell to it? I'm going to tell you, looking at somebody and saying, is there something coming out of your vagina that smells, is going to be rough on both of you. Even being in the field as long as I have been, I would still rather not have to ask that to a patient. But if I can look at them with not that little twinkle of, oh, I'm going to laugh in my eye, and say, you know, this is necessary for me to know how to treat you, then things tend to go a little bit better. The more professional you are, the better. Are you sexually active? Is there a possibility you may be pregnant? And if she says no, you should always follow that up with, how do you know? So if they've been using condoms, that is not a foolproof way. That definitely does not mean they're not pregnant. I've been taking birth control. Okay, if you're taking pills, do you take your pills on a regular basis? Have you ever missed a pill? Have you missed a pill recently? Or have you been on oral antibiotics? Oral antibiotics render hormonal birth control that you take orally less effective. So she may take her pills religiously without missing one. She takes them at the same time every day like you're supposed to. But you know what? She did have that strep a couple of weeks ago, was taking oral antibiotics on top of it. Well, guess what? That can fail. Sterilization is more what we consider to be indicative of not being pregnant, or abstinence. Obviously, if she hasn't had sex, she can't get pregnant. If she says, well, I'm breastfeeding, I can't get pregnant. Not true. You can get pregnant while you're breastfeeding. If she says, you know, use of any other contraceptive method other than IUD, sterilization, or abstinence, there is still likelihood that she could be pregnant. So keep that in mind. Special challenges in obtaining a patient history. Silence. Some patients seriously just don't want to talk to you no matter what's going on. Patience is very important. This is their emergency, and so being calm and understanding with them is helpful. You want to determine if the fact that they're being relatively silent is part of their chief complaint, part of their reaction to the situation that's going on, or if there's something they just don't want to tell you. And oftentimes we can get little clues as to what's going on. Patients that are overly talkative, you'll have these as well. A reason that a patient might be overly talkative could be that they've taken a heck of a lot of caffeine. There are people that have medical problems every day from having too much caffeine intake. They might be nervous. Nervous tends to make people just word vomit out of their mouth. They want to tell you about everything, and if there's any sort of silence, man, they are running their mouths. Ingestion of cocaine, crack, methamphetamines, all of those upper drugs, those can get you going. They could have an underlying psychologic issue. Bipolarism, you have the mania portion of that where they just are high on life, man. But that can be a reason to get them overly talkative. The problem with people that are overly talkative is that trying to obtain really important details about what's going on might be really difficult, because this is going to lead into that, that's going to lead into that, and pretty soon the train is no longer on the tracks, it's going somewhere and you have no idea how you got there because they're just talking. None of it makes sense, none of it combines together. They are just talking to talk. Good luck with that, because it's rough. Multiple symptoms, especially as you get into the older patients or those with chronic complaints, they often have several different things wrong with them at the same time. And what's really wrong with them might not be what they're complaining of. You want to start with the most serious issue that could be affecting your patient and work your way backwards to the least serious. Anxiety. Um, Even with somebody that doesn't have anxiety, a lot of times they will have at least a little sense of anxiety just because they've been thrown out of their normal routine. And now we're bringing in people that I don't know to take care of me for something that I truly would rather not have or have anybody around. Some different signs of anxiety include pallor or kind of getting pale. Diaphoresis is that sweating, shortness of breath. They can actually get chest pain that has nothing related to do with the heart itself. They can get numbness or tingling in the hands or feet. If they're hyperventilating and not taking in enough oxygen, the body does that whole shunting thing to make sure the vital organs are getting it, which causes your fingertips to get numb, to get tingly. You can actually even get what's called carpal pedal spasms in your hand, where your hands start clenching against your own will, and that tends to freak people out and make it even worse. They also could get a loss of consciousness. Some people get so overwhelmed that literally they lose consciousness. You would think that that's just in horror movies, that, you know, the girly girl ends up fainting because of the scene. Real people do that too. No joke. Anxiety could actually be part of their complaint as well. Low blood sugar can cause anxiety, shock, hypoxia. So it may not just be in their head. They may have some significant reason for why they're acting the way that they're acting. Make sure that you try to determine the difference between the two. Anger and hostility. This could be the patient, this could be their friends or family, this could be just random bystanders who get very upset. We tend to come on the scene and be very calm, very confident. Everybody else on the scene is freaking out. There's those scenes where no matter what you do, it's just going to be a circus. You can see the lions over here, you can see the clowns over here, and everybody's just running around like crazy. That is ridiculous. And you're going to find yourself getting annoyed at that, but you need to be calm. You need to be reassuring. You need to be very gentle with people. If the scene's not secured or not safe, make sure you either get it to the point where it's safe or you leave. You don't need to be there if it's not safe. What you can do if you've got somebody that's overly anxious or overly hostile, distract them. Give them a job. Give them something to do that steps them away from where you're at. Just, hey, can you go get something for me? Doesn't really matter what it is, but just give them a second to step away. If not, PD needs to get involved. we'll continue on in the next one.